Hi, everybody, and welcome to our talk on diabetes devices strike back. So this is part of our virtual conference on May the 4th, so it's very Star Wars themed.
May the 4th be with you.
So if you're watching it at our conference, that makes sense. If you're watching it later, that's why you might see some TIE fighters and things like that flying around. So this is a very important talk. We could do it every month because this is constantly evolving, constantly changing. We got a lot of tech to talk about, so let's get into it. So the way that we're going to organize it is talking about new CGM systems first, and then what's going on right now in the pump world.
Yeah, there's so much new stuff, as you said. And we got 20 minutes to cover all of this information.
Yeah.
You go first.
So buckle up. All right, so starting with CGM, we're going to start with the Dexcom G7. So Dexcom, obviously, they always, update. They went from G6, G7. This is smaller than the G7. It's much easier to put on because it's just one device. There's no separate transmitter and sensor anymore. What other perks do you like about it?
Yeah. Warm-up time.
Yeah.
Oh, my God. They say 30 minutes, but by the time as soon as you put it in, the clock starts to tick. Mm-hmm. And as soon as you pair it up, it's like 25 minutes. And that is amazing. And you get an extra 12 hours. And the other thing I was going to mention is that it's got the form factor and the insertion pressure is just so much nicer.
It's just a lot easier to put on. So I think a lot of people have been waiting for this to change if they've been on a pump, specifically the Tandem pump, just as, semi-recently upgraded so you can use the G7 with your Tandem. We're still waiting for the Omnipod to update, but maybe even by the time this airs, that will have happened. That should literally be any day now.
And the iLet, which we will be talking about, is upgraded to the G7.
Mm-hmm. So these things, you always have to do them in tandem. We've had the G7 for a while, but a lot of people are waiting for integration, but now we have it. I will say, when I first tried the G7, I had a lot of connectivity errors. You might have read about that online. That apparently has been fixed with some updates, and both on the side of the iPhone and with the sensor, that's supposed to be a lot better.
I saw it on the nightly news. It was so big. We should say, though, that the G7 we'll be able to connect to future devices as time goes on, and we'll talk about those.
Yeah. All right, so next is the Libre. So Libre now has upgraded to the Libre 3, but it's slightly confusing that there's still the Libre 2, and they're calling it the 2 Plus, because now that can actually integrate with your Tandem pump, which is the first time I think that we've ever had a pump that can work with multiple different continuous glucose monitors, which we're hoping is kind of a little bit of a sign of the future of pick your CGM, pick your pump, and you don't have to be locked into, kind of one or the other. So if you've been using the Dexcom and you've had issues with it, and that was kind of the closed door for you for getting onto a pump, you can try the Libre 2 Plus, use that with your Tandem. So again, more options.
Yeah, the 2 Plus, if you remember, is the one you have to scan. And you can't have a scanning CGM if you're going to have it communicate with your pump. So the 2 Plus is basically just a
Well, it doesn't.
a 3.
You don't have to scan it
right
when you use it with your pump. That's the point you're making. Yeah.
Oh yeah. Okay. That's right.
And then with the Libre 3, you can see it's smaller. It's actually a little bit more accurate. You get a reading every minute. So all these systems continue to update and just more kind of choices for people.
Yeah. The one thing I was going to say about the G7, and it's also true with the Libre, you can't fake it out and get longer days out of it. A lot of people love the G6. You pop out the transmitter, you fake it out. You can get 10, 15, 17 days out of it. So you can't do that anymore. Yeah. And that's probably a good thing. Well, because at some point the data it
falls off, and you used to get question marks back in the day. Now I'm showing my age. It's not available yet, but apparently in the next year or so, this is hopefully to be approved, that Abbott is working on a dual continuous glucose meter with a continuous ketone meter. So you'll always know what your blood sugars are, and as well if your ketones. And even if you're not familiar with what a ketone number is, it'll notify you if you get high, so you can do something about it to avoid diabetic ketoacidosis. So just not only developments in continuous glucose monitors, but measuring other things kind of continuously.
Yeah, and a lot of you folks on insulin pumps, sometimes you don't realize the infusion line comes out. Mm-hmm. And there's also the class of drugs, SGLT2s, which help the kidney, the heart, and those can cause ketoacidosis. Not very common, but you want to be the first to know about it.
They're amazing drugs like Farxiga and Jardiance that we use all the time in type 2 diabetes, other things. But people with type 1 can't use them because they increase the risk of ketoacidosis. This may be a way to have people use it safely.
Yep.
All right, next sensor, one that you know well, that you're using right now, the Eversense. You want to talk about it?
Yeah, this is the Eversense. It's called the Eversense 6-month E3. There's a tiny little sensor that you have a 15-minute office procedure. They put it under the skin. They put some steri strips on over it, and it stays there for 6 months. And then that little dark thing that you can see on the screen, it's the transmitter, and it sends the information to the smartphone. And so it's a different form factor. It comes down to personal choice. Some people say athletes love it, swimmers, scuba divers, or someone that just doesn't want to deal with the prescription issue.
Or if you had like bad adhesive reactions.
That's
I've
true.
had a number of patients have horrible rashes to whatever it is, Dexcom. This you can take off every day. It's much less kind of sticky in a good way, so people generally don't have adhesive issues.
Yeah, and to talk about the pipeline a little bit, as we did with the Libre continuous ketone monitor, they are working on the I designation to communicate with insulin pumps. So right now they don't have that. And then the other one, they're working for the 1-year sensor and calibration once a week. Currently it's once a day. And in the ultimate future, they were making a sensor and transmitter that goes completely under the skin. So nothing on top.
Yeah. We actually had our good friend, Dr. David on, who Steve trained, who worked with us at UCSD, came down, I don't know, 6 months or so ago and actually did the implant in our TCOYD office. And we filmed it. So it's on our video vault if you want to see how David did this procedure in about 15 minutes. I can do it in 14, but like whatever.
But we should also say that he came down just a week ago and did a TCOYD live on technology where we had a whole hour to talk about what we're talking to you today in 20 minutes. We did have a couple of complaints about that video when he put it in. People complained there was no blood.
Oh, because
he did such a clean cut,
maybe.
And sorry, gang.
Yeah, you weren't complaining.
Next time I'll get out some fruit punch Mio and squirt it all over the place.
All right, so we're kind of leaving CGM behind, because now we're going to talk about pumps, which obviously are now working with CGMs. And, if we did this talk 2 years ago, it really was just kind of the Tandem. But since then, we now have like 4 systems that are commercially available. They all have their pluses and minuses, but they all keep getting better and better. So let's talk about them. Let's talk about them in the order, kind of the way that they came out.
Sure.
So we'll talk about the Tandem pump first. What do you want to say about that?
Well, remember the Medtronic 670G was first.
Yes.
But people stopped using it because they had lots of issues. But we're excited to tell you about their new 780G. The Tandem Control IQ is a traditional pump with tubing. In the beginning, it partnered with the G6 Dexcom, and they communicate with each other. And all of these systems use predicted glucose from your CGM to give you a little bit more when you need it and to slow down insulin delivery and stop it when you don't need it. And it's all based on what we call an algorithm. How would you describe an algorithm to someone like Albert Einstein?
It's just some kind of math formula, basically, that it predicts what your blood sugar is going to be and kind of comes up with how much insulin you should use, basically. And, the Tandem pump is one, we've used all these products between the two of us, I think. It's a really nice pump. Obviously it has tubing. I think the interface is really nice. It's very easy to use.
You like the touchscreen.
I like the touchscreen. I like the rapid bolus feature on top. You can actually do remote bolusing now with like your phone, which is another like big update. So these things actually can be updated now also because they have, software that's updatable versus our old pumps back in the day when you'd be scared, like what if an update comes out and I'm locked into this for 5 years or whatever. That's going away a little bit now that we can actually update these systems.
A good example is the G7.
Yeah.
You can, for folks on the G6 and the Tandem Control IQ, you can upgrade online to the G7. And that's nice because it's as we mentioned earlier, some nice upgrades.
Now, so new from the world of Tandem is what they're calling the Tandem Mobi, which is their kind of semi-tubeless option. It's more of a patch pump is what I should say, that it's a much smaller form factor so you can wear it kind of on body. It still has a small amount of tubing. So unlike the Omnipod, you actually can disconnect it, if you want to get out, go in the shower or whatever, and then kind of clip it back on.
You could take a shower with it. Omnipod.
Yeah, but you can't take it off, like the Omnipod really, without putting on a new pod.
Yeah, that's
true.
true.
That's kind of one of the differences. But this is something that you would do all kind of remote bolusing and things like that through your phone. But it's just an option for people that want to, wear something on their body and maybe they like the Tandem products. So that all these things are extremely new. This is one that I haven't tried because it's actually so new.
Yeah, it holds 200 units and the Control IQ holds 300 units. It does have a rapid bolus button, which you like, which is nice. And it's going to be a hybrid closed loop system that hooks up to the G7. So it's really smaller, it's different form factor, and it's for people who don't use as much insulin and love the fact that they don't have to wear the bigger pump. So it's options.
All right, so the next transition, or the next natural transition, would be to talk about the Omnipod 5. So tell us about it.
Yeah, to give you a quick historical background, the Omnipod came out over 15 years ago, and it was what we call a dumb pump. It did not communicate with a CGM, and the pods looked the same. They actually got a little smaller.
All pumps were dumb pumps back then, because they didn't communicate. But yeah.
Mine was really dumb. And it's a great form factor. You fill it up with a syringe on the bottom. You pull off the tape. You put it in different spots, probably more spots than you can put it in an infusion line. And then you initialize it, and then it'll insert the catheter for you, and you're done for 80 hours. At the end of 80 hours, it stops completely. You got to put a new one on. But the Omnipod 5 is the latest version that is the hybrid closed loop, where the pump communicates with the Dexcom G6 currently, soon to be the G7. And it does the same thing the other algorithms do, but the details, we can't tell you, but it's based on your total insulin usage, where you set your goal glucose. Every algorithm's a little bit different, and it does a great job of keeping you between 70 and 180. Not all the time, because we know there's no system like that, but it's an extremely good algorithm.
Yeah, and the main thing about the Omnipod has always been that it's tubeless, that people don't have to, you're not getting caught on doornails or door knobs or whatever it might be.
Doornails is really that.
Really nice to have that you can put it on different places of your body, might be a little bit more discreet. And then it's controlled by an Android device. So if you have an Android phone, you just need that one phone. You can do all your bolusing. Currently, if you have an iPhone, you'd have to carry around this other Android system. So two things, but that's being changed so that they can get it kind of integrated with the iPhone. So you can start to see when people say, what's the best, system I should be on? It really comes down to some of these kind of like non-glucose things. Do I want tubing or not? Do I have an iPhone or not? What CGM am I on? All these kind of things go into it. And again, when people say, what's the best one in terms of blood sugars? We really don't know, because to get approved, these studies are usually, comparing the device, the Omnipod 5, versus just, being on a CGM and a pump that doesn't communicate. And we don't have any head-to-head studies, really, of what's the Omnipod 5 like versus Tandem versus the Medtronic. We don't have those. So we don't really know, but I would say that you would probably agree that they all behave very similarly in terms of their clinical trial results, improving time and range, reducing hypoglycemia, improving A1C a little bit. So, when you're picking a system, kick the tires of these other functionality things.
I think you're absolutely right. You'll never see head-to-heads. There's 4 of them now. It would take 50 studies in 10 years. And, I think it's important to say that, and I've always said this before, that these systems will take care of your blood sugars about 80% of the work. The rest is up to us. Are we giving our bolus 20 minutes earlier? Are we trying to stick to lowish carbs? Are we looking at our numbers and making adjustments based on the trend arrows? And so things like that. You and I both have patients that have these systems that do horribly, not too many. And we also have patients that just knock it out of the park, and most of the rest knock it semi out of the park.
Yeah.
And, clinic for us has gotten boring. A1C is good, time and range above 70%. You know what I talk about, their favorite Peloton instructor. That's about it.
And it's important to know with each of these different systems what you can still modify or not. It's not like, for most of these, it's not like you just go on and it takes care of everything. You still need to program some basal rates, carb ratios, these sensitivity factors in general, but working with your educator to know which of these things you can adjust on these different systems, because they all are becoming a little bit different.
Yeah, and it can get complicated. The bottom line is, if your metrics look good on your download, you're golden. But when you're getting too many lows or you can't deal with exercise, there are important settings that your healthcare provider, your endocrinologist should know.
Yeah. All right. So let's move on to one system that's actually probably the most different, I would say, in terms of the algorithm of all these. It's called the iLet. So Steve, you want to tell us about that?
Yeah, the iLet is a whole new type of insulin delivery. What's amazing about this system, and Jeremy studied it at UCSD, is that when a doctor initiates it, you need a prescription for all these systems. All you put in to the pump is the patient's weight. And typically, heavier people need more insulin, lighter people need less. And then it uses machine learning and
an algorithm.
Yeah, an algorithm. I was trying to be fancy. And it looks at, it has several algorithms actually. Mm-hmm. It looks at your total insulin use. It looks at, how you respond to meals. And when the user sits down to a meal, they just pretty much announce it. It doesn't mean they say, "Hey, I'm going to have breakfast." They push a button that says large, medium, or small.
Well, that's the biggest difference, is that there's no carb counting. So when you announce a meal, and you don't have to, but it performs a lot better if you do, you just say, "I'm eating a typical amount for this time of day, slightly more or slightly less." So the people that do the best on this system are the ones, for the lack of a better word, who are just kind of tired with their diabetes. They don't like doing the carb counting. I mean, that's everybody. But the people that don't like to tinker very much, this pump does a good job of getting you in a reasonable range without much work. Now, if you're somebody who really likes to be, kind of looking at every minute to minute, looking at your carb ratios, all these things, this might not be the pump for you. So, as an example, when your blood sugars go up with this system, there really isn't anything that you can do about it. People might be tempted to enter like a fake meal, but that can really mess up the system. So you really have to be hands off with this system. So I would say that's simultaneously the biggest benefit and maybe a little bit of the crutch to the person, depending on where you are in terms of how involved you want to be.
Yeah, if you think about it, we're talking about all these settings: insulin to carb ratio, basal rate, sensitivity factor, duration of insulin action, all kinds of settings that you could change on the other system. This one, you just stick it on. And I think you have to be patient.
Yeah.
And you have to be honest.
So, there's some people listening right now and say, "Oh my God, sign me up for that." And there's some of you listening saying like, I don't want to have anything to do with that. I like tinkering. And there's nothing wrong with that, but it's just about knowing the options.
And remember, it's a tubed pump.
Yeah. And
like the Tandem and the 780G, which we'll talk about next. And the other thing is, it's important to know the reservoir is 180 units.
Yeah.
Which is less insulin than the Omnipod.
Right.
And less than the Tandem Control-IQ.
So if you're using more than like 50 units a day-ish, you might have to change it out more frequently, like every 2 days instead of every 3 days.
And that's not a big deal if you like it, right? You just have to change it out. And what I learned yesterday, talking to Matt, is that the cartridges for the iLet, it comes pre-filled with Novolog, so that you don't even have to worry about getting out a vial and syringe and sucking it in like you'd have to do now. You just buy it at the pharmacy. It's available, and you put it in and you go. So it's really easy.
And the iLet was always initially designed to have two hormones, insulin and glucagon. Insulin to bring your blood sugars down, glucagon to bring your blood sugars up. The dual hormone, the double hormone, is still in clinical trials, but it might be soon that we'd have an iLet, the insulin-only version, and then with both hormones, so kind of stay tuned for that.
And a lot of people think that's really going to help improve your time and range.
Yeah.
Okay.
All right, last system, the Medtronic 780G. So tell us about that.
Yeah, well, the 760, 670.
Yeah.
Gosh, I said it backwards.
I know, the numbers, it gets hard to remember what's
2017, the first hybrid closed loop, God bless them. But because it was the first time you're giving people with diabetes insulin automatically, they had to be really cautious. Lots of safeguards, lots of double checking the sensor with your finger. And so people didn't like it.
Yeah, you had to still calibrate your blood sugars like 4 times a day if you wanted it to work. If you did all that, it did a good job, but it was a lot of work. So Medtronic is, really hasn't had an update since then, and they're back in the game.
They are
new system.
They're back. Yeah, they have a new sensor. It's very accurate, and they have an extremely good algorithm.
And the difference with a sensor is that you have to calibrate it once when you start the sensor, right? But then that's it. So still one finger prick, but that's way better than 4 times a day.
Yeah, and I tried it for 3 weeks, and it worked extremely well. It kept me in range better than any system I had been on. But maybe I was trying harder because I knew people were watching me from the cloud. But it's a really good system. It's now competitive. And now, Medtronic's going to get back in the game and we'll have more choices.
Yeah, and there's a lot of people out there that have used Medtronic forever, their whole lives, so it's just good to have them kind of like as another option. So, after all this, You got 4 hybrid closed loop systems, a handful of CGMs. I mean, it's really just, it's blown up in terms of all these things. It's hard for us to keep up with all the pluses and minuses. So we love hearing from you guys. And absolutely, when you go to your provider, if you have a strong opinion, tell them, hey, I definitely know I want the Omnipod. If you don't, ask them, pros, cons. And the majority of these companies have like a 30-day free trial that they might not necessarily tell you about. So ask about that. So in the event that you don't like it, change it back in so you don't feel like you're locked into that system.
I think that's really important.
Yeah.
So you want to try them and then you'll get a real feel for them.
Yeah. Well, with that, that's, we did it in 20 minutes. Good job, buddy. So hope you guys enjoyed it. We'll see you at the next one.